name is Hugh Kim. I am the director of the UBC Center for Blood Research, and I'll be hosting today's event. There are a few people whom I'd like to acknowledge and really sincerely thank. So from the CBR office, the work for putting on today's event really was done by Mira, Jamie, and Jessica, especially Mira, who did the majority of the heavy lifting to coordinate all the logistics today. So when you see them today, just please extend our heartfelt thanks for their help. We have a number of volunteers without whom the event wouldn't be possible. So all of our poster judges, mic runners, all the other volunteers, we really, really appreciate all of your help with this. We have a number of sponsors without whose support we could not have put on such a wonderful event. We're very, very grateful for your support, most notably Cirrus, Grifols, Canadian Blood Services, and the Naaman Vickers Endowment Fund. So we really, really appreciate all of your continued support, and we look forward to future partnerships. So today's event is dedicated to Dr. Norman Bethune. So Dr. Bethune was a Canadian physician born in Gravenhurst, Ontario, eventually attended medical school at the University of Toronto, notably in the same graduating class as Frederick Banting, one of the discoverers of insulin. So after a brief stint as a surgeon at McGill University in Montreal, Dr. Bethune served in the Spanish Civil War. And so this is really where his major, I guess, claim to fame was his dedication to developing a system to transport blood to wounded soldiers, as opposed to having them brought off the field to the hospital. So this is really what Dr. Bethune is famous for, in addition to him being an ardent advocate for universal access to healthcare. So his leanings were arguably socialist. Some have labeled him as a communist, but there's certainly no disputing that Dr. Bethune's reason for being really was to provide universal access to healthcare and to help people in need. So the Center for Blood Research, the CBR, have always been and will continue to be dedicated to excellence in research in blood and blood-related processes. So this year we're very, very fortunate to be able to welcome 3 new members to the CBR. Dr. Gerald Levy, who's appointed to the UBC Department of Pathology and is a professor emeritus at Duke University, and he is joining us today, visiting from North Carolina. So Gerald, welcome. Dr. Jim Zimring, who's also appointed to the Department of UBC Department of Pathology. Jim is the Chief Science Officer at Canadian Blood Services. Unfortunately, he couldn't be with us here today, but we certainly wholeheartedly welcome Jim to the CBR. And most recently, Dr. Florian Kuchenbauer, who is a clinician scientist and hematologist-oncologist, and a distinguished scientist at Terry Fox Laboratories at BC Cancer. So we're really, really fortunate to have recruited some new individuals to our CBR team, and look forward to their contributions, and conversely that we are looking forward to providing a warm academic environment for them as well. We have a great program today. It's a rather full program. So we have 4 sessions of talks interspersed with breaks and lunch. So thank you very much once again for attending. Without further ado, I'd like to introduce our first speaker, who is